Hi, welcome to another edition of MIA Minutes. I'm Joe Spiatko, the Communications Director here at the Maryland Insurance Administration. And with me today is Ruth Getachew. She's our Director of HCAT. So right off the bat, Ruth, what does HCAT stand for?
HCAT stands for the Health Coverage Assistance Team. And we are here and we're set up within the Maryland Insurance Administration to help individuals navigate their insurance questions, right? Pertaining to health insurance particularly. So if you have any general health questions about what is a deductible to what is a pre-authorization, the Health Coverage Assistance Team can help provide answers for those. But if also you have questions about a service that was denied or wanting to file a complaint, the Health Coverage Assistance Team can also help you navigate those as well. And so we're really set up to help an individual figure out what their next steps are with regards to their health insurance and healthcare needs. And so the Health Coverage Assistance Team will walk alongside the consumer and make sure that they get to the right place.
How did HCAT come about? Because I know this is a fairly new program here for us at the MIA.
Yeah. So HCAT is really just an extension of the services that the Maryland Insurance Administration already provides, right? We're here to enhance the support that we give to our Maryland consumers because our goal is to educate and protect Maryland residents. So the Health Coverage Assistance Team was set up to really help individuals regardless of their health coverage, right? Because the administration is only responsible for about 20% of health policies that are administered in the state. And so the Health Coverage Assistance Team is really a place to help answer questions for all of those health coverage options that aren't necessarily regulated by the Insurance Administration.
Okay, so tell us how the process works if someone gives you a call or they click on a link on the website, and walk us through how the process works.
Sure, yeah. So an individual reaches out, they give us a little bit of what is going on, right? They might explain exactly what service was denied, or they're trying to obtain a service and don't really understand how to get coverage for it. So they give us a little bit of information about that. They give us some demographic information so that we can help figure out what resources are available in their community. And then from there, an HCAT team member will go through and figure out what those next steps are. From there, the specialist that is assigned to your case will go through and walk you through what those next steps are. Whether that's calling a different organization, whether that's filling out a paperwork, or whether that's just providing education on the topic that they called in about.
Okay, so can you maybe give us an example of somebody who was helped by HCAT? Maybe a real life example of how we at the MIA were able to assist somebody?
Sure, I can give a couple of examples.
Sure.
So individuals that have called in a lot recently, we've gotten a number of questions about the Medicare birthday rule. And so individuals have called in just asking about what that guaranteed issue right looks like, asking if they are within their guaranteed issue right period. We get some very specific questions about whether or not if they left their Medicare Advantage plan, would they be issued a guaranteed issue right period. And the HCAT members are trained on those different policies because Medicare supplemental policies are regulated by the administration. And so we would help that individual navigate what their next steps are. So that's one way that we've helped consumers. Another way that we've helped is individuals that are on the Maryland Medicaid program. We've also helped them get to appropriate entities if they have any questions, help them understand the resources and services that are available to them, and also just understand what their policies cover. So that's one of the other ways. We also helped another person that has called in that has a plan from their employer, and they had a specific question about adding their child on that was over 26. So typically individuals or children, adults over 26 aren't part of your employer-based coverage, but in certain circumstances, you can have them added on, and so we were able to help this individual add their child onto their policy, even though they were over 26.
So it sounds like the HCAT team members, kind of act as almost like a bridge to get people to where they need to go. Is that a fair way to maybe describe what we're doing to help Maryland consumers?
Yeah, exactly. The idea here is that we want to be a central resource for Maryland consumers because the systems that are currently set up for health coverage can be incredibly complicated. So they include payors, so when you think of your insurance companies, they include healthcare providers, they include different rules and regulations depending on your coverage type. And so the idea is that the health coverage assistance team is set up to help individuals navigate those different systems and be a central resource for Marylanders. We're not here to duplicate services, right? There are lots of organizations and agencies here that help provide support as well. HCAT is really here to make sure we can get you to the next step the most efficiently.
Okay, and toward that end, what's the best way that a Maryland resident or consumer can reach out and get a hold of somebody at HCAT?
Yeah, so there are 3 different ways that a consumer could reach out to us. We have a phone number, and that phone number is 410-468-2442. We have an email address set up for HCAT, and that is hcat.maya@maryland.gov. And then the last way is through our web form on our website, and our website is insurance.maryland, spelled out, .gov.
Okay, with us again today is Ruth Getachew, and she's the director of our HCAT team. And we'd like to thank you for coming in and sharing what it is you're doing to help Maryland consumers today.
All right, thank you. Thank you for having me.
All right, you're welcome.